The Cynthia Goh Palliative Care Fellowship Program was established in memory of Professor Cynthia Goh. Professor Cynthia Goh, that everybody knows, has been a pioneer in palliative care in Singapore and across the region. The legacy of her work will continue with us as the APHN continue to ensure our vision to make sure everyone in the Asia-Pacific region will continue to have equity in access to good hospice and palliative care. The Cynthia Goh Palliative Care Fellowship is not just a program, not just a leadership program, it's actually a movement. It is the APHN mission to nurture the next generation palliative care leaders, clinicians who can be advocates to palliative care and could be policy shapers and also community builders. We are expecting to nurture about 30 palliative care physicians, doctors in the Asia Pacific region to continue to propel palliative care into the national system of every country in Asia, and hoping that all the leaders in palliative care will upkeep the clinical standard and bring awareness to the palliative care in the Asia Pacific region. It is also the APHN mission and vision to ensure equity of good palliative care and hospice care to everyone that needs it in the Asia Pacific.
So important that palliative care becomes upstreamed in all our countries, all our sectors in the Asia Pacific region. And so what we really need to foster is that development of being able to upstream, advocate, get essential medications, funding for palliative care programs. And so that viability and ongoing reach through the whole region will be by fostering more and more leaders, that these leaders in part nurture and pass on their passion and inspire them to be, and create a whole network of like-minded people with unique, diverse and individual skills that they bring together. So collectively, we have a huge voice for palliative care in Asia Pacific, but individually in their country, they become amazing leaders that mushroom out other champions for palliative care.
Well, this fellowship really provides me with quite a lot of resources and avenue to continue my professional and leadership development. Different aspects like having really a community to share, and there's lots of peer learning with other young leaders, and to share about our passions, our different projects and initiatives and the challenges. So this safe platform to share is really great for peer learning. The initiative that I was involved in is the Train the Trainers program in Bhutan. Although this program has started in 2018, during the COVID, it was stopped because we are not able to fly in, and because of the passing of Professor Cynthia Goh, who was really the leader and the driver for this program, this initiative. After that, I had to learn how to continue that work, her passions, and I really very much want to help it and make it blossom. So this availability of this fellowship, avail some of the leadership skills and development that I really need to continue this program. So in 2003, I managed to go with Giam, the Executive Director for APHN, to really continue and do some new stakeholder engagement in Bhutan, meeting Ministry of Health in Bhutan, meeting representatives from the nursing faculty, the doctors faculty, and that accumulated in 2 of our modules in 2024. And also we're going to continue those training and modules this year. So I would definitely recommend to anyone, my juniors who would, want to have this opportunity and be committed growing some of these programs which is outside of their home country. Yeah, I think the more people who join this fellowship, the more enriching it is for the participants.
So we in Singapore actually comes from a very privileged background. Our forefathers in palliative care, our first generation, has fought the battle over the past 20 years to build a very robust and mature palliative care ecosystem on a small island in Singapore. because of the fact that we not only share our treatment protocols and the way that we do things in Singapore, but also we have to discuss and co-create with our Chinese counterparts how to adapt, adopt, and fit some of these treatment protocols to, bring about the best interests to our patients that are in need of palliative care in China. So by learning how to operate in a wider context whereby we are dealing with different culture, different laws, different access to medications, we learn to be flexible, we learn to have a macroscopic overview of the healthcare system. And in that manner, it helps me grow as a budding healthcare leader in the domain of palliative medicine. It also empowers me and gives me the opportunity to form strong and lasting friendships with overseas faculties who share similar core values, of compassion, of trying to help patients who are vulnerable and who are in suffering. And that kind of networking opportunity, I feel it's very rare and almost like a once-in-a-lifetime kind of experience. So it is something that I greatly value. And I hope that younger healthcare professionals like myself would be given the opportunity to then learn from such an experience as well.
I think the entire fellowship has been a very exciting journey for me. First and foremost, it brings about a very rich network of different palliative care fellows globally. So we have Naveen from India, Shirley and Neo from Singapore, and also May from Philippines, and I'm representing Malaysia. Each of us bring in a very rich tapestry of cultural differences, the way we provide palliative care, the way we collaborate. So working together has been one of the greatest learning experience for me. We are learning from one another. I'm observing them, what they are doing in their country, what has worked, what has been the major milestones on how to improve and how to work with different team members. How do we want to upstream palliative care? So I feel that this entire fellowship has provided a very good platform to learn new skill sets, to learn different things, and it has also been a very enriching experience. Definitely, I will encourage those who ask about wanting to join Cynthia Goh Fellowship Program. In fact, there's a few who have already asked me. And I think the main reason is, firstly, it is a very individualized program. Every country's fellows will have very different projects. It will look very different for different ones because it is according to the needs in your country. However, there is also a collective project that we do together. So while we have certain initiative that will work for your country, for your own personal growth and development, there is also a collective project that will enable you to learn skills from one another.
Hi, I'm Camilla Rowland from Palliative Care Australia. I'm the Chief Executive Officer, and I'm really happy to be part of the Cynthia Goh Foundation Fellowship Program. This is an incredibly important global program. It ensures that we are meeting needs for the future, that we will have doctors who have been involved in conducting research, helping to ensure there is clinical leadership across our globe. And of course, they'll be involved in collaborating on research and involved in helping develop the palliative care system of the future across Asia and of course the region. We would encourage people to participate and be involved in this really important program.
So from the perspective of the Cynthia Goh Fellowship, effective leadership is defined beyond clinical leadership. So many of the fellows are given the support for the work that they do in their own countries with respect to palliative care. And many of them are specialists in their own way. But specialists need to influence, to motivate, to bring together stakeholders to collaborate for the greater purpose. And for the collective good. And this in itself requires a different set of skills altogether. For me, I define leadership as a social skill, meaning it's a skill that involves people, and that skill is to enable a leader to influence another person to dream better, to think better, and to be better. And it doesn't stop there, because to dream better, think better, and be better, it must be towards a group of shared goals. Which is why in the Cynthia Goh Fellowship, we are talking about leaders becoming better, not just for themselves, but collectively. Because only in the collective can the impact be multiplied. For example, ultimately the fellows will have to be working across the public sector, the private sector, as well as the people sector. And because all these sectors are very diverse and made up of people with their own sets of aspirations, their own dreams, their own objectives, it takes very strong leadership skills to be able to bring them to a common purpose and then to align themselves to that purpose in the things that they do, the things that they say, and to bring others along so that more and more people are committed to a larger cause for the greater good. So all these different flavors, they are coached to be collaborative leaders. Firstly, understanding themselves, how they manage conflicts, understanding how the other person manage conflicts, come to a compromise first, learn to trust each other, and then move towards a collaborative. Yeah. So these are some of the areas. Of course, there are many, but these are some of the common areas that I'm happy to share.
The Cynthia Goh Palliative Care Fellowship was established in honor of Prof. Cynthia Goh. Prof. Cynthia has been a key part of the foundation work in palliative care, marking our entry point several years back. After her passing, we realized actually the light of leaders like Cynthia is absent in the Asia Pacific. And we were thinking about how best can we maybe build a group, a community of palliative care leaders who is prepared to cut beyond their institutional boundaries and want to do good for the betterment at the national level or at the Asia Pacific level. And which is also why we decided to formulate the ideas of setting up this fellowship. And I'm very glad that we have a very good first cohort of 5 fellows who are doing well-regarded and established work in the region itself. So we look at the Cynthia Goh Palliative Care Fellowship as a natural complement to the Lien Collaborative for Palliative Care, which is run with APHN. I mean, one of them is about starting services in the region, and the other one is about grooming services. To us, this is natural synergy, and I think I look at it as probably a responsibility that we can do something for the betterment of the Asia Pac.
Hello everyone, I am Dr. Naveen Salins. I am the Professor and Head Department of Palliative Medicine and Supportive Care at Kasturba Hospital, Manipal. Also, there are emerging respite model of palliative care. There are vocational rehabilitation, especially in people needing long-term palliative care, and there are caregiver support lines that has been established with an intent to develop capacity.
To be able to use that form of blended learning.
When I was granted the fellowship, I was already 20 years or so into my palliative care journey, so to say, and it was in those first 10 years, being a palliative care leader in some ways already, I learned from those who went before me and tread the path. I learned from their journey and their inspiration. So I, at the time, was learning more through inspirational leadership. There's still so much that can still be done. It's just that not within the hospital. I saw that this needs to be brought really to the larger community. I saw the gap between those who can afford home care and those who cannot. And I said we need to start something to help. When you're alone, it's very difficult. As I started, I thought I could, just go out there and do it myself. But then I realized you can't. It really needs a interdisciplinary team. You have to really sit at least not less than 30 minutes with the patient and the family to assure them that you're there for the long run. And they can call on you, and you have to establish that connection. We have to be a team to care for them.
Yeah, that's why the community is so important.
Yeah. No? Yes, and that's another part of our advocacy, Mitch. We need to start having these conversations to really a community approach. Because some of the referrals come because they don't know what to do and they want to just be able to talk about what to do. We learn the basics again about being a compassionate healer, how to be a good listener, and how to just be able to assess your patient by listening first. And so that's what we've had to relearn and to come to terms with our own mortality. That's the first thing I teach, actually. Whoever is interested to learn, they have to come to terms first with their own mortality, and the fear of that has to be managed first.
Yes.
Because you can't enter a room when you're afraid yourself. So definitely I would recommend to apply for this fellowship, because even though we were the first batch and there's still areas where we are learning together. I think that is actually one of the important parts of this fellowship program, because we're learning from each other. A lot of us are practicing in different levels of palliative care provision, a lot of levels of integration depending on the countries, but yet our shared experiences is very valuable. At the same time, I'd recommend it to our younger colleagues because it may not need to take 20 years for them to level up, like maybe I had to. You can do both inspirational leadership, servant leadership, alongside transformational leadership already. Learn those skills early on together. And that's why I'm so excited for the younger generation, younger leaders in our country to be able to engage themselves in this program. So they, at the start, will already have that vision of becoming a transformational leader while maintaining that servanthood with the tools that we were able to learn through our one-on-one mentoring through this fellowship program and group mentoring. So definitely, I would recommend and encourage my colleagues to apply and to be part of this, because we need more leaders of this sort in order to really improve access for our fellow Filipinos, especially those who are less fortunate in disadvantaged areas. So definitely it's something we need.